VYZULTA, latanoprostene bunod ophthalmic solution, 0.024% is indicated for the reduction of intraocular pressure, IOP, in patients with open-angle glaucoma or ocular hypertension. Please see important safety information at the end of this video.
I think the key right now in glaucoma management is understanding both efficacy and achieving that efficacy we desire, but also at the same time maintaining high patient satisfaction. And I think we're now understanding much more the impact of fluctuating IOP and the influence of lack of compliance on that fluctuating IOP. So for me, when I start with my treatment regimen, I'm always thinking, okay, how can I get down to the lowest pressure possible but while maintaining high satisfaction? And usually it's a PGA type of a medication first line.
I think the key things for any glaucoma medication are three things in general. So you have mechanism of action, you have safety, and of course you have efficacy and IOP lowering. And I think VYZULTA hits the mark really on all three.
In terms of incorporating VYZULTA into your clinical practice, my suggestion would be to use it in a wide variety of patients so that you get a flavor for its efficacy as well as its tolerability. Use it in 20 to 30 patients that have either pseudophakic open-angle glaucoma, primary open-angle glaucoma, both mild, moderate, even in a severe case. It doesn't have any on-label restrictions in terms of where you can use it. So that would be my suggestion. Get a good feel for it before you make any assessments of its capabilities, because it really has been, at least in my hands, a drug that has been beneficial all along the spectrum of the disease.
So how do you start using VYZULTA if you haven't used it before? Well, I think there's a number of ways to assess any new medication we give, right? The first thing is start it on new patients. I would start it on patients of all types. I think we tend to say, okay, I'm gonna wait, or I've tried everything else, I'm gonna try this new drug. Well, you can do that, but you may not have the efficacy you desire, because sometimes when people are advanced and they've had a significant amount of glaucoma for many years, they may need a surgical option. So I think the best chance is when the patients who are earlier, mild to moderate, a new start, or even a switch, because I think understanding the value compared to, let's say, latanoprost, I think it's important to see how this does work in patients who are switched over. Remember, not every single patient is gonna have a significant reduction when you switch over. It doesn't mean it's not valuable. It may be a point, half a point, maybe 4 points. If you look at the data that's been published on VYZULTA, comparing, let's say, to latanoprost or brand name Xalatan, about a 1.23 mean difference between latanoprost or Xalatan and VYZULTA. It doesn't mean that every single patient got 1.23 additional reduction. Some people may not have significant reduction. Some people may have had 4 or 5 millimeters. So when you do a switch, don't just do 1 or 2 patients. Give yourself at least 10, 15, 20 patients to give yourself an understanding of the value. And I think a new start and a switch I think are very important to give yourself the best opportunity to understand what is the true value of the drug, but also the tolerability of the drug as well.
VYZULTA, latanoprostene bunod ophthalmic solution, 0.024% is indicated for the reduction of intraocular pressure, IOP, in patients with open-angle glaucoma or ocular hypertension. Important safety information. Increased pigmentation of the iris and periorbital tissue, eyelid, can occur. Iris pigmentation is likely to be permanent. Gradual changes to eyelashes, including increased length, increased thickness, and number of eyelashes, may occur. These changes are usually reversible upon treatment discontinuation. Use with caution in patients with a history of intraocular inflammation, iritis, uveitis. VYZULTA should generally not be used in patients with active intraocular inflammation. Macular edema, including cystoid macular edema, has been reported during treatment with prostaglandin analogs. Use with caution in aphakic patients, in pseudophakic patients with a torn posterior lens capsule, or in patients with known risk factors for macular edema. There have been reports of bacterial keratitis associated with the number of multiple dose containers of topical ophthalmic products that were inadvertently contaminated by patients. Contact lenses should be removed prior to the administration of VYZULTA and may be reinserted 15 minutes after administration. Most common ocular adverse reactions with incidence of greater than or equal to 2% are conjunctival hyperemia, 6%, eye irritation 4%, eye pain 3%, and installation site pain 2%. Please see full prescribing information at VYZULTA.com.